to Pain Points. Today we're going to be talking about spinal cord stimulation, and today is part one of a four-part series. Now, if you joined me last week, you might be saying, well, wait a second, Dr. Caylor, isn't this the exact same thing we talked about last week? And the short answer to that is yes, absolutely. But we are still kind of working on a day-to-day basis to figure out some of the technical stuff because to be honest, we do pain. And so we're trying to figure out how can we best educate patients. And so we're working on the technical aspects behind the scenes. So we're going to repeat last week's session today so that we can try some new things out to see if we can get better video coming through. So that's what today's all about. So thanks for joining me. As always, the goal of these sessions is education and advocacy, both for ourselves as well as our family members and other people that we love. The medical field is extremely challenging to navigate, and chronic pain is one of those disease processes and syndromes that's extremely challenging to suffer with. And while it might seem like we have very few options, in reality, we have a number of new and emerging therapies. And so part of this entire series is focusing on, well, okay, how is the pathology generated that's causing me pain, but what are some of the options and what's the science behind it? Because if I'm a patient and I'm trying to figure out, do I want this therapy? Do I want this spinal cord stimulator? Then what is the evidence for it and how does it work and where does it go and what's the entire process look like? So that's the point of this. If you haven't met me before, my name is Dr. Jake Caylor. I'm a double board certified interventional pain physician out of Austin, Texas. I'm an expert in spinal cord stimulation, and this is what my research is in. And I want to make sure that we're delivering this therapy to the patients in the best way possible. This is an interactive talk. So if you have questions throughout, please lay those questions out, and I'd love to discuss them. So let's get started. Today, we're going to be talking about spinal cord stimulation. Specifically, what is spinal cord stimulation? On a very fundamental level, how does it work and what are the parts involved? Next, we're going to be talking about a very brief history lesson as an introduction to spinal cord stimulation. And lastly, we're going to be talking about the pieces of the puzzle. What are the components of spinal cord stimulation and how do each of those play in the entire experience of spinal cord stimulation? And then we're going to be talking about the differences between a trial, if you've ever heard about a spinal cord stimulator trial, versus the actual implantation of the device. And so that's what this little video on the right is showing, a needle going in, through which we insert a wire that has electrical contacts, onto which we can stimulate the spinal cord. From there, we can connect to a battery and actually reprogram the spinal cord and how it interacts with the brain. Oftentimes in pain medicine, I hear spinal cord stimulation being described as a pain blocker. And in reality, this just isn't true. It's not blocking the pain signals. What's challenging for patients with chronic pain is that we often think that pain started at some point, whether that's before or after a surgery, or whether pain got worse with some particular motion or some trauma that happened, and that must be the pain generator. But in reality, we're dealing with time, and that time cost is that the longer that pain has been there, the longer we have things like altered biomechanics and changes in the way our brain and spinal cord interpret pain signals. And this can lead to long-term problems with pain and how our brain interacts with the rest of our body. Spinal cord stimulation is not a pain blocker. No, the problem is generally not out in my arm if I continue to have arm pain 20 years later. In fact, the problem is actually with my spinal cord and brain and how they interact with my arm. Spinal cord stimulation is in fact changing how our brain and body interact with one another. And in essence, I describe it as a reprogramming. So join me on this journey as we talk about spinal cord stimulation and how it works. So what is spinal cord stimulation? The spinal cord is really the electrical superhighway between the brain and the body. Everything that gets to the brain has to go through the spinal cord. And because of that, the spinal cord is a wonderful target if we're trying to program how the brain and the spinal cord interact with the rest of our body like my painful arm, or on this diagram, my painful foot, for example. In the body, we have a pain stimulus, such as what's coming from the foot, and that's going to go through a nerve into the spinal cord. And that's what this funny looking butterfly picture here is. It's a picture of the spinal cord. So that nerve is going to go into the spinal cord, and those little blue boxes are where it connects to another nerve that goes up to the brain and sends other signals. This is a prime target for us to be able to perform what we call neuromodulation. And that's really the problem with spinal cord stimulation is it's not stimulation at all. If the spinal cord is the superhighway, stimulating would be adding cars to the freeway. We're not doing that. We're fundamentally changing how the cars are moving on the freeway. We can utilize electrical pulses to change how the brain and the spinal cord are interacting with the body. And the reason we can do that is because all of these pathways, this electrical superhighway, is fundamentally rooted in electrical activity. These signals are electrical signals that are moving from one place to another. So we can use electricity to reprogram them. We can do things like direct traffic. We can slow down traffic, or we can even take some of those cars off of the road completely. And that's really what we're doing here. We're not stimulating, we're not adding additional cars to the highway, we're not building new highways. We're changing the flow of information in the spinal cord and how that brain interacts with it. A brief history of spinal cord stimulation. It's really interesting because neuromodulation actually has its foundations rooted all the way back to 15 AD. And how the brain and the body really interact has been kind of going on for quite a long time. In 1965, the gate control theory of pain was introduced, which essentially demonstrated that if you're rubbing a part of your body, you might be able to block a pain signal that's coming from that same part of your body. And that process of rubbing the body or employing a different type of stimulus or sensation to the body could override the pain signal. So in 1967, this young up-and-coming neurosurgeon named Dr. Norman Shealy got the bright idea to utilize this theory and actually start to reprogram the spinal cord. And he thought, okay, I'm going to take some electrodes and I'm going to put it on one of my chronic pain patients. And the first patient this was actually done in was a cancer patient that had cancer pain that was causing this radiating pain into the chest wall. So Dr. Shealy actually put some electrodes directly onto the spinal cord and sent some stimulation into the spinal cord. And that completely blocked all of the pain that was coming from the patient's cancer pain. And the patient felt a nice, comfortable buzzing and tingling. And if you've had a spinal cord stimulator trial or heard about the buzzing and tingling, that's where this comes from. It comes from, this isn't experimental technology that we're working with here. No, this has been around for all the way since the 1960s. So we have a good amount of fundamental basis and the science as well as the product itself that we use. Shortly thereafter, the first spinal cord stimulator came out, and then in the 1980s, the first fully implantable spinal cord stimulator battery came out. And so these patients were able to have systems that lived inside their body as opposed to wires that came out of the body. After this, a number of different types of therapies came out. And this is the true evolution of spinal cord stimulation, when spinal cord stimulation stopped being so much about what can we stimulate, but instead became how can we reprogram. And when we stimulate, when spinal cord stimulation is exactly what we say it is, when it's stimulation, the patient can feel it. They can feel it as buzzing and tingling. And while that might work for some patients, we were finding as physicians that it wasn't working for everyone. And so because of that, we had to start getting creative and figure out, okay, we have this wonderful technology. How can we utilize it to treat pain without stimulating? Because not everyone likes that feeling. And so a number of different therapies came out until our most recent one that came out in 2020, known as differential targeting multiplex therapy. And this therapy actually uses multiple different waveforms at different locations to reprogram the spinal cord. And so we have burst therapy, we have high frequency spinal cord stimulation therapy, differential targeting multiplex therapy, all of these different types of therapies are aimed at how can we reprogram and fundamentally change the spinal cord without stimulating. And so in reality, spinal cord stimulation is not stimulation at all. It's reprogramming and the word neuromodulation. So let's talk about what are the components of spinal cord stimulation. There's going to be some wires, which you have here on the upper right, and there's going to be some batteries, which you have here on the lower left. These are the fully implantable devices, and here's an X-ray of a battery connected to a wire with some electrodes that goes onto the spinal cord. So the first component is the leads. These are two wires that each have 8 electrical contacts. We use these contacts to create electrical fields within the spinal canal. Secondly, we have the pulse generator. The pulse generator is really a battery to be able to drive that electricity, and a microchip so that you can actually send the correct programs, but also communicate with the outside world. So while these devices might be implanted under the skin, they can still communicate and in fact be charged from outside the body. So how does the overall process work? So we've got this great idea, spinal cord stimulation. You might have chronic pain, you might have had back surgery, you might have complex regional pain syndrome, diabetic neuropathy, chronic refractory pain that has just not gone away with any therapy, or you might not be a surgical candidate, or you might not want surgery. That might not be in your best interest. And you think, okay, spinal cord stimulation might be the right thing for me. How does the whole process work? Simply, there's 2 parts to it. There's a trial and there's a permanent implant. And each of these happen in phases. So the trial is a process whereby we put temporary wires into the spinal canal and perform a 7 to 10 day test run. And this is really, really critical. Here on the screen, it's a little bit choppy, I apologize, but you will be able to see some wires that we're putting in under live X-ray into the spinal canal. And those wires are driven up into the spinal canal and allow us to be able to target different aspects of the patient's pain. When we have the test wires in, we perform what we call as a mapping, and that's when we're actually stimulating. So we're going to put on that stimulation, and that stimulation is going to let you tell us where you feel the buzzing and tingling. And that's a very critical part about spinal cord stimulation. Because as much as we like to think as physicians, all of our patients are the same, the anatomy should be the same from patient to patient, in reality, there's nothing more complicated than the brain and the spinal cord. So that's why I test every single time, where are you feeling the buzzing and tingling, and can we get appropriate coverage of where you are having your painful areas? Because if I can't get that coverage, then I'm not confident that I know where the neurons or the neural tracks are that I need to do my modulation on. During the trial, so this 7 to 10 day test run while we're testing it out, the try it before you buy it, if you will, we're doing daily check-ins where we're evaluating what's your response to the therapy. How is this going? And we're reprogramming so that with a trial, what we're trying to accomplish is truth. We want to identify truth. We're not looking for an answer because none of us want to put in a device that is not going to give you long-term relief. So we're really looking for a home run. And during that trial period, we're working really hard where we talk to you daily, where we reprogram when we need to, change the therapy to try to really take advantage of this special time that we have to be able to figure out, is this therapy going to be something that fundamentally alters your life? After the trial is over and we've determined whether it's a success or not a success, we take the wires out. And that's the beauty of spinal cord stimulation trials, is that you truly get to try it as opposed to commit to it. And that's the hard thing about spine surgery, for example, is that with spine surgery, you either have to do it and just see if it helps, or you don't do it and you're unsure if you should have ever done it. With spinal cord stimulation, It's really under this guise of no harm, no foul, because we're going to take the test wires out anyways, and you can see if this is the right therapy for you. And that's what I like about the trial. Nope, nothing permanent about it, and there's no commitment. So what does a trial look like? And this might be the choppy part, so I'm going to explain it first and then let the video play. So the first thing we'll do is we'll numb up the skin, and then afterwards we're going to insert some wires, and those wires are going to go into the epidural space through a small needle. Now this is a animation, so none of this actually looks anything like this. And the patient would be prepped and draped sterilely. It's not done non-sterilely through the back like this with no surgical technique. But just for kind of animation purposes, this is what we're going to see. Some wires going into the epidural space through a small needle. So what that is putting in the wire, adjusting the wire to find the sweet spot where we're getting coverage, and then connecting this wire to an external device. The needle comes out. You have a wire now directly connected to the spinal cord that allows us to do our programming. We sterilely tape and dress everything in place. Now, at this point, I want to talk about when do we decide to go to the permanent implant? And for me and my patients, the goal of the permanent implant is to replicate what we've done during the trial, which is why I tend not to do short trials. I don't do 1 or 2 or 3 day trials. We do longer trials, and we really try to figure out if this is the right therapy for the patient. We want to figure out, is this something that's going to benefit you long term? So we work really, really hard during that time period. So the implant is when the patient has decided this is the right therapy for them. This is what I want to commit to. And then part of that commitment on my part is I'm going to be involved in the process. I will help work with the device company and program the device so that you continue to get the relief that we've experienced during the trial. And this is the importance of finding a physician wherever you go who's invested in actually doing the programming with the device company, because that's critical to maintaining long-term success, as opposed to just call the device company and let me know if there's an issue, because that's what leads to problems. Your cardiologist wouldn't say, call the device company for a pacemaker. No, the cardiologist would say, I'm going to be involved in that. And that's very, very critical. So the implant is very similar to the trial. It's actually the exact same procedure, except you have 2 small incisions. The wires go into that exact same location, and it's the exact same procedure we just did. We connect the wires to the battery and put those under the skin, and it's just like a pacemaker. And now we're going to watch a video of what that looks like, and it's very similar to what we just saw, except you're now going to see a small incision that the device is connected to. So at this point, what we've just seen is that the device was installed under the skin and connected to the wires that go to the epidural space. After this, the patient has a device that they can use to communicate with their battery, and this is called their programmer. And this actually allows them to change the stimulation so that we can continue to get long-term relief, but also you have some control in terms of delivering the therapy. Now, that doesn't mean that you can do all of the complex programming we need to do with this device, but it does give you some safety in case you need to get an MRI, in case you want the therapy up, in case you feel something that maybe you shouldn't be feeling, which we wouldn't expect, but let's say you do and you say, I want that down a little bit, then you have some control over that. And that's one of the things that's really, really important to be able to have for patients is some control over the therapy that they're using for treatment of their chronic pain. But the trial is the exact same as the implant, except there's 2 small incisions in the implant. So in summary, spinal cord stimulation is not stimulation. It is actually neuromodulation, meaning that we are using targeted patterns of electrical impulses to fundamentally change how the body is interacting with the brain and spinal cord. And that is a novel thing. We are not covering up pain. We are not blocking pain. We are trying to reprogram and reintroduce the normal way that the spinal cord and brain are interacting with the rest of our body. The programming and what we put into the device matters. It's not just a stimulator that we're blasting the spinal cord with electricity here. What we're doing matters. The specific programming matters. And on the right here, you can see this is actually from a paper that I wrote. And if you're ever interested in reading it, I apologize. But if you're ever interested in reading it, it's about 58 pages long. And it talks about how spinal cord stimulation works. And not just how, but how each of these different stimulating parameters works. And this is going to be something that's so critical because all of these different parameters influence which neurons we're activating or inactivating, which ones we're programming, and which ones we're saying we're going to leave those ones alone. So not only the stimulator, but the type of stimulation we're providing is critically important to whether spinal cord stimulation works during the trial and whether it continues to last afterwards. And we'll talk down the road about how spinal cord stimulation works in each one of these. Not only what we're applying, but where we're applying that electrical current is really, really important. So that's the other thing. It's not just, can we get you to feel it? Can we blast the spinal cord with electricity? That's not what we're trying to do. What we're trying to do is actually the art of medicine. It's the subtle fine-tuning of the correct pain pathways while we leave others alone. We'll take questions if there are any at this time. Otherwise, as always, join us every Thursday at 12:30. I do have to apologize. I will be out next Thursday, so we'll continue the week after with our second part of our spinal cord stimulation workshop, where we'll be kind of working through the nuts and bolts of spinal cord stimulation. And we'll continue to learn about how it's a therapy that may or may not be right for you, but should definitely be done in the correct way for all of our patients. And thank you all for joining me. And if you want to, please leave a comment. Thank you for the comments. I see them right now. I really, really enjoy this. If you have questions, please reach out to me. If you have other things that you want to talk about, please reach out to me or leave those on either the YouTube or the Facebook page, because we'll continue to work through these as we go throughout the rest of this year. Spinal cord stimulation is an amazing therapy for the right patient, and we're going to continue to work on finding you the therapy and teaching you about the different pain options we have. So thank you, and I will see you not next week, but the week after.